the first risk has got to be the risk of the general anesthetic and the surgery. Now, every surgery that we do carries some risk. In some cases, that's a pretty big risk. In other cases, it's a very low risk. Every anesthetic that we do, even if it's just for an investigative procedure, does carry a risk, albeit a very small risk. Now, it used to be that when you got a female puppy, you'd book them in to have them spayed at about 5 to 6 months old. But there's more and more evidence, or there's more and more discussion that spaying your dog, especially if you're spaying them early, could be detrimental to their health. But what's the truth around that? Well, that's what I'm discussing in today's question about a Labradoodle whose owner is deciding whether they want to spay them and when that time of spaying should be. But before we get into this really big topic, I need to cue the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Welcome to another week of Call the Vet. If we've not met before, I'm Dr. Alex and I'm the veterinarian behind ourpetshealth.com. And my aim is simply to give you the information that you need so that you and your pet can live a healthier, happier life. So definitely consider subscribing, hitting that subscribe button on whatever podcasting app you're listening to today, so that you don't miss out on any future content. And also, you need to know that I'm answering your questions. So if you do have a burning question for me, if there's something that you've always wondered about the best way to look after your dog or cat, or if they've become unwell, or if they're injured, or there's something else on your mind about pet health care, then just head over to callthevet.org and submit your question for answering on an upcoming show. And I can't run this show without you. So whatever question that is, go to callthevet.org, submit your question, and you never know, I could be answering your question next week. But as for this week, I've got a really big topic. So the topic of spaying your dog is one of the most important decisions that you might need to make in your early dog's life. It can make a massive difference to their ongoing health, to their future health, and even their health in old age. So it's definitely a decision that you want to be getting right. And as time has gone on, kind of more and more recently, there's been more research done into timing of spaying. And so that's what I'm going to be discussing today. So without further ado, let's get into today's question.
Get your questions answered at callthevet.org.
And today's question is from Paracha, who wrote in to say, I have a 7-month-old golden doodle, golden retriever and poodle mix, and I'm considering getting her spayed at 12 months of age after the first heat cycle. What's your opinion? She will be around 50 pounds fully grown. So this is actually a really common thing that people are asking these days. They may have read online, they've seen some videos, listened to some other podcasts about the potential benefits as well as the potential risks. A lot of material is actually very one-sided. So a lot of it will say, these are the benefits, this is why you should get your dog spayed, and just get it done. It doesn't really matter what the age is. And then other pieces of information, and a lot more recently, are going, this is what is going to happen if you get your dog spayed, full stop, or if you get your dog spayed before 12 months of age. They will get all these problems, and there's no really kind of black and white situation like this. There's a lot of grey areas, and unfortunately a lot of other places, certainly the ones that I've seen, they don't really have a discussion about weighing up the benefits, the potential benefits and the known benefits of spaying a dog versus the potential risks and the known risks of spaying, and then empowering you to make the best decision for you and your pet. And that's really what Our Pet's Health is all about, and the Call the Vet show and all of the other content that I produce is all about. It's about trying to give you a fair and balanced overview of the risks and the benefits, or the pros and the cons of doing whatever it is that I'm talking about, and allowing you to make a decision that's based on your pet, based on your lifestyle, your family, all that kind of stuff. So let's start by saying, what are the benefits of spaying a female dog? And there are a number of known clear benefits. Now, the first one that I'll discuss, and the first one that's got to be one of the biggest benefits, is the prevention of pyometra. So if you don't know, pyometra is an infection of the uterus, and I kind of describe it as the uterus becomes like a big balloon full of pus. Now, that as you can imagine, doesn't sound very nice. That can be incredibly serious. It can be life-threatening, and dogs do die from that if they're not treated appropriately. And pyometra affects a really high number of female entire dogs. So about 1 in 4 dogs by the age of 10 will develop a pyometra if they're left entire. So really it is very common. 25% of entire dogs by the age of 10 will develop a pyometra. So if we're removing the uterus and if we're removing the ovaries specifically, then that eliminates the risk of pyometra. Fantastic. Now, the next benefit of spaying is reducing mammary cancer risk. So about 13% of dogs by the age of 10, and so 1 in 12 entire female dogs will die of mammary cancer by the age of 10. So that's a pretty significant statistic as well. And we are fairly sure about how we can reduce this risk. So if we spay before the first season, and the first season is generally at about 9 months of age, although that does vary by breed and by individual. If we spay before that first season, then we reduce that mammary cancer risk by around 99.5%. So we don't quite eliminate it, but we massively reduce that risk. If we delay things and spay before their second season, then we reduce it still by a really fantastic 95%. Before their third season, we get a reduction of about 75%, so still pretty significant. If we're spaying later than that, then the benefit regarding mammary cancer prevention really starts to drop off, and it's not quite so marked. Although if your dog does develop mammary cancer, if they've been spayed at the time of removal or within the previous 2 years, they do have an improved survival. So there are definitely benefits to spaying a dog when they're a little bit older than that third season or after that third season. So that's mammary cancer risk. Now, a longer life is another benefit of spaying a female dog, and that does vary by breed, but it does seem that on average spayed neutered animals do live longer. Another benefit is it reduces roaming. So if your female dog is spayed, they're not going to come onto heat and then be looking for a mate, and that really increases their risk, especially of being actually hit on the road. So roaming animals, they will kind of cross highways, they'll do whatever it takes to breed. So if we're eliminating their desire to breed, then actually we do reduce trauma risk as well. And I certainly don't see these days the hit by car cases that I used to. Now that it's become more standard, more routine for our dogs to be castrated and spayed as well. And then the final thing that the final benefit of spaying your dog is it eliminates pregnancy risks, things like cesarean sections and eclampsia, which is low blood calcium, both of which are emergency situations and can potentially be life-threatening as well. So those really are the known benefits of spaying a female dog. So we're preventing some pretty serious conditions and some pretty common conditions. Certainly pyometra, 1 in 4 dogs by the age of 10. Mammary cancer, about 1 in 12 entire dogs by the age of 10 will die from that. They're pretty common things, but it's not all positives, it's not all roses. There are some potential risks of spaying your female dog. The first risk has got to be the risk of the general anesthetic and the surgery. Now, every surgery that we do carries some risk. In some cases, that's a pretty big risk. In other cases, it's a very low risk. Every anesthetic that we do, even if it's just for an investigative procedure, does carry a risk, albeit a very small risk. Now, generally, these risks in spaying an otherwise healthy female dog, especially a healthy young female dog, they're less than about 0.1%. So that's a pretty low risk. It's not zero, though, so that's something that you do need to bear in mind. Another big risk, and one that we do know that spaying causes or contributes to, I should say, is urinary incontinence. So this is actually higher if we spay our dogs very young, so about 3 months of age, there or thereabouts. But this doesn't appear to change depending on when we spay our dogs at other times. So spaying them at 6 months, at 12 months, at 18 months. There's some recent evidence to show that all of those ages produce about a 3 times increase in the risk of urinary incontinence. There's not any benefit to leaving them a little bit later from this point of view. It might be that understanding changes, but there's definitely an increased risk of urinary incontinence, so about 3 times the risk. Now, another big risk of spaying, and something that unfortunately is very, very common, is obesity. So far too many of our pets, our pet dogs and our pet cats as well, are overweight. So in the US, it's something like about 60% of dogs are classified as either overweight or obese. So that is a huge proportion of the population. And being spayed does increase the risk of that. There's an increased propensity to lay down fat. There is a reduction in the amount of energy that's actually required. And unfortunately, all too often we are overfeeding our dogs. So it's really important that knowing this, when you get your dog spayed, or I should say if you get your dog spayed, that you do concentrate on feeding them appropriately for not just for their breed, not just for their activity level, but also for their neutering status as well. If they're spayed, they need to be fed less. But ultimately, keeping an eye on their weight, knowing that that's a risk, will allow you to feed them appropriately and hopefully prevent them from ever suffering from obesity or even getting slightly overweight. Now, let's move on to some of the things that there may be an increased risk with. So cruciate ligament injury and joint growth abnormalities are really big ones that there's been a lot of chat about. And there is some evidence that the risk of these problems are increased in certain large breed dogs if they're spayed before 12 months of age. Now, it's really not clear cut, though, as there's kind of no difference in some breeds, and there is seems to be a difference in other breeds that are very closely related. So the example here is that golden retrievers that are spayed before 6 months of age have a higher risk of cruciate ligament rupture, but Labradors don't. On the other side, Labradors spayed before 2 years of age seem to have a higher incidence of hip dysplasia, but our golden retrievers don't. So you can see we've got two very similar breeds, but their risks are very different. Now, this then makes it very difficult to make general broad brush recommendations, because do we just accept that one breed has a higher risk or seems to have a higher risk but another one doesn't? We'll ignore the one that doesn't and just say there is a higher risk? Or do we say, well, actually we're not really sure, we need to do more studies, there is a potential risk here and it's definitely something that we should consider, but I don't think we can say that as this is a black and white situation that anyone can say with a really high degree of certainty. Now, there may also be an increased risk of certain cancers if we spay before 12 months, but again, that's really not clear, especially with the exact increase in that incidence. So have we got a really small increase in a really rare cancer, or do we have a big increase in a really common cancer? That really just isn't clear. And all of these cancers that there is a potential increased risk in are much less common than that mammary cancer we've already spoken about, where actually spaying significantly reduces and almost eliminates that risk depending on when you're getting your dog spayed. So you can see from all of this data and all of this discussion, and actually I've got a blog post on over at ourpetshealth.com all about this that goes into a lot greater detail about all of the potential nuances of these risks and benefits. So definitely head over there and check that out, and I'll leave the link in the show notes. It's a really comprehensive review. But from all of what I've discussed, it'll be clear to you that really it's impossible to make any sweeping generalizations, make any broad brush generalizations regarding neutering and the risks and benefits of, all of these different procedures. So, really have a little look at, go back and have a little look at that article and weigh up the pros and cons for you, for your pet, depending on what breed they are, what size they are, what your risk profile is as well. Are you happy to keep a really close eye on them, and at the first sign of a pyometra, at the first sign of mammary cancer, have the surgery that needs to be done then? That also comes with sometimes a pretty significant cost. Certainly a pyometra, if that happens as an emergency after hours procedure, you could be talking multiple thousands of dollars for that surgery and hospital stay associated with that. Equally, if you're removing multiple mammary glands, that's going to cost a significant amount of money, and that really needs to come into your decision making as well, because if you can't afford the surgery for a pyometra, it goes from becoming a very treatable and very survivable condition to one that actually is therefore fatal because you can't afford the treatment that needs to be done. So that needs to be factored into your decision making as well. But don't be pressurized into thinking that you need to make the right decision, because there's no such thing. It is the right decision for you, for your pet, and for your family. So there's a unique set of circumstances that need to be considered. But all that being said, what are my general broad brush recommendations, if you like, knowing everything that we know. Well, for small breed dogs, I do still recommend that we spay them when they're about 6 months of age before their first season, because I don't think there are any significantly increased risks of doing it that early, and we get the maximum benefit, especially when it comes to reducing the risk of mammary tumours. For larger breed dogs, however, and where there is no risk of them becoming pregnant and where they can be successfully managed while they're on heat, so there's those caveats, I actually recommend delaying the procedure until they reach 1 year of age or even a little older before. So we're doing it kind of after 12 months and before they come into season for the second time, which is generally about 6 months after they come into season for the first time. So that's my recommendation for larger breed dogs. And the reason being is because I recognise that there is the potential increased risk of cruciate ligament disease and of joint dysplasia as well. So hip dysplasia, elbow dysplasia, other joint growth abnormalities. And I think if we can really reduce the potential risk of those, then our pets are going to be much healthier going into their older age, especially when it comes to arthritis and all that kind of thing. So that's my general recommendations, but like I say, there's a lot to take on board and there's no right decision. You may completely disagree with me, and that's absolutely fine. That's your prerogative, as long as you understand what the potential consequences of your decision are. So that was quite a juicy topic to cover for today, and there's lots of nuances, like I say, so definitely encourage you to head over to the show notes. You can find those at callthevet.org to check out some of the stats and to check out that other article that I mentioned that will go through things in much greater detail. And it's definitely something to consider, because once your dog's been spayed, you can't put everything back, so it's a decision that you really need to be happy about and that you need to be comfortable making, because it will, and it's likely to have a massive impact on your dog's future health and happiness. But anyway, that's it from me for today's episode. Remember to subscribe if you're not already, so you don't miss out on any future episodes. And also, if you do enjoy the show and you're a regular listener, I'd appreciate it more than you can imagine if you could take the time to head over to Apple Podcasts or whatever podcasting app you are listening to and leaving the show a 5-star review. It helps more than you can imagine with other people finding this podcast, with surfacing it in search, and with letting people know that it's something that's worth their time listening to and will help them and their pets live a healthier, happier life. So with that in mind, take care. I'll see you next week. I'm Dr. Alex. This is Call the Vet. Bye for now.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.